In the hall of the Médecins Sans Frontières post-operative care centre, Zainab is waiting for her appointment. On July 24th, a candle lit during one of the daily power cuts set fire to the mattress she was sleeping on. 7 years old and with severe burns to both legs, she's no longer able to walk. Following the accident, she was admitted to the burns unit of the Al-Shifa hospital in Gaza and was later referred to the MSF clinic for outpatient care. 3 times a week, a nurse changes her dressings.
I'm doing dressing for her to prevent the infection, to protect the wound from the microorganism, like that. شاطرة أنت.
20% of burn patients at the MSF clinic are victims of domestic accidents. Like Zainab, most of them need reconstructive surgery. It was here at Nasser Hospital in Khan Yunis, the second largest city in the Gaza Strip, that Zainab had a skin graft.
Do nothing. So we just bring her to duty in the way she is. Yeah.
MSF works here in collaboration with the local health authorities in order to reduce the patient waiting list. In Gaza, delays mean that more than 500 people have to wait at least 1 year for the surgery they need. Dr. Hassan Hamdan is the head plastic surgeon at Nasser Hospital. For him, MSF's surgical program is also an opportunity to share skills between surgeons.
Basically, our staff face a lot of difficulties as the siege prevents us from leaving Gaza. This stops us from sharing and exchanging information with others. These visits from external medical teams are very helpful.
Despite recent improvements, the Gaza Strip embargo continues to affect the health system and the population of Gaza. Forget the pictures of children with swollen stomachs and absent gaze. It's time to rewrite the story of malnutrition, this time free of cliches. In collaboration with MSF, 7 photographers from the photo agency 7 travelled 3 continents to shed light on the stories of malnutrition in 2010. The campaign, called Starved for Attention, comes with a petition.
Plants sprout within a couple of days and grow far faster than I've ever seen before. So it feels a little bit like the malnutrition that shouldn't be if the fighting and the insecurity would just stop.
In Burkina Faso, a mother fights for her children. In Mexico, an ambitious national program has produced radical change.
Oportunidades program, it goes beyond just the clinics for healthcare. Education on how to take care of yourself and how to feed yourself nutritiously, making sure that people are eating.
In the United States, a double standard prevails. On the one hand, impoverished American families receive aid to buy eggs and milk for their families. On the other, public food aid to poor countries offers nothing other than a mix of corn, flour and soya, which is inadequate to fight against malnutrition.
Why would we be giving out food through a food aid program anywhere in the world that we wouldn't be using for our own kids and families?
Today, adapted nutrition products exist. With sufficient political will, these products could reach the 195 million malnourished children. Starved for Attention is asking the main countries providing food aid to embrace this approach.
This exhibition is touring France and other countries to explain the issues raised in this campaign and to ask people to sign a petition that will be sent to the leaders of the main donor countries.
The campaign has already been presented in New York, Milan, Toronto, Abidjan, Rome and Paris. The work of these photographers is available online. The petition, also online, will be presented in spring 2011 to the leaders of the G8 summit in France.
There is a solution. Here's how a patent pool could work. Companies give their HIV patents to an independent organization called a patent pool. The pool then acts like a one-stop patent shop. Companies and researchers can access patents in exchange for a fair royalty payment to the inventors.
In December 2009, Médecins Sans Frontières welcomed the idea of setting up a patents pool for medicines, and an important milestone has just been reached. The first patent has been contributed to this mechanism.
An important institute, the National Institutes of Health, the principal body of public research in the United States, has offered to this patent pool the patent that they own on the antiretroviral drug darunavir.
Although this single patent isn't enough, it's a first step towards the production of this HIV medicine at lower cost for developing countries.
For the moment, it doesn't allow us to do anything because additional patents of the drug darunavir are still held elsewhere, in particular by Tibetec, owned by the American company Johnson & Johnson. But we will often find ourselves in these situations where there are several patents for a drug. So it's important that the other holders also put the rights to their patents in the pool.
It's an important move forwards. If others follow the example, it will help develop new combinations of drugs and make treatments for HIV/AIDS more accessible.
MSF welcomes this announcement because it really is an important gesture and encourages a public organisation to offer its licences to this patent pool. Furthermore, it incites, it puts more pressure on the pharmaceutical companies to give access to their patents.
MSF currently treats over 160,000 people with HIV/AIDS. 80% of ARVs used in NGO projects are produced by generic drug companies in India.